Good day. I'm Dr. Esther V. Antonio, an obstetrician gynecologist and OB-sonologist here in the Medical City, South Luzon. Today, I will be discussing with you the changes that happen to a woman's body during her pregnancy. Every organ of a woman's body undergoes physiological adaptation during pregnancy. It begins soon after fertilization and continues throughout pregnancy in response to the stimuli provided by the baby itself. During your first trimester, changing hormones may make you feel tired, have nausea and vomiting, and painful breasts. But during your second trimester, hormone levels out, any signs of vomiting may lessen, and you may feel a heightened sense of well-being. Your breasts change during pregnancy to prepare them for feeding your baby. These changes are caused by an increase in hormones. These are pain of the nipple and breast, darker nipples in the area around them, and an increase in breast size. Your skin color may also darken a little, either in patches or all over. Birthmarks, moles, and freckles may also darken. In addition, up to 70% of pregnant women experience a darkening of skin on the face. This condition is known as melasma, or the mask of pregnancy. It can be worsened by sun exposure and radiation, so a broad-spectrum sunscreen should be used daily during pregnancy. In most cases, melasma resolves after pregnancy. Some women develop a dark line down the middle of their stomach called linea nigra. What is the reason for linea nigra? The specific cause of the linea nigra is unknown, but it is believed that the hormone created by the placenta is the main contributing factor. Striae gravidarum are linear scars that represent one of the most common changes during pregnancy. It can cause emotional and psychological distress for many women. Striae gravidarum, or what we call stretch marks, occur in about 50 to 90% of pregnant women because of the separation of underlying connective tissue as the uterus enlarges within the abdominal cavity. Striae starts as reddish, slightly depressed streaks and fade gradually to leave pale, wrinkled lines, which unfortunately are permanent skin changes. Stretch marks are not likely to go away on their own. How do you prevent stretch marks in pregnancy? So here are some tips. Number 1 is control your weight. One of the most helpful things you can do to prevent stretch marks, whether you're pregnant or not, is to maintain a healthy weight. Second, stay hydrated. Drinking enough water may help keep your skin hydrated and soft. Soft skin doesn't tend to develop stretch marks as much as dry skin does. Drinking caffeinated beverages like coffee may actually increase your risk of developing stretch marks. If you drink coffee, make sure you're balancing out your fluid intake with plenty of water. Number 4, eat a rich nutrient diet. Stretch marks may also occur if you lack nutrition in certain areas. Number 5, include vitamin C in your diet. Collagen plays a role in keeping your skin strong and elastic. It helps reduce the appearance of wrinkles, but it may also be important for preventing stretch marks. Vitamin C is an important nutrient for the development of collagen. Soak up some vitamin D. One study found a correlation between low levels of vitamin D and the incidence of stretch marks. More research is needed, but results suggest that maintaining healthy levels of vitamin D may reduce your risk of stretch marks. The easiest way to get vitamin D is through exposure to the sun. Eat foods rich in zinc. Zinc is an important nutrient for skin health. Treat fresh stretch marks when they appear. If you can totally prevent stretch marks on your skin, you can work to minimize their appearance so they aren't as noticeable in the long run. Make an appointment with your doctor or a dermatologist to discuss your options if you have fresh stretch marks. Your doctor can help determine what is causing your stretch marks, and they may be able to suggest treatment options that work best on your new stretch marks. Diastasis recti means your belly sticks out because the space between your left and right belly muscles has widened. It's very common among pregnant women. About 2/3 of pregnant women have it. Excessive inner abdominal pressure causes diastasis recti. During pregnancy, your abdominal muscles and connective tissues are stretched out from your expanding uterus. They help along the pregnancy hormones relaxin and estrogen. Pushing during delivery can also lead to diastasis recti. So I will be discussing next the cardiovascular changes that happens to your body when you're pregnant. They warned you about vomiting. You knew you'd gain some weight, but no one said anything about swollen fingers, swollen ankles and cheeks and toes. All the pregnancy swelling is certainly an eye-opener. Things you don't know could get swollen, suddenly blow up like a balloon. If you're expecting noticeable swelling in your feet and hands during pregnancy, you're definitely not alone. Pregnancy can cause pitting edema, and it usually resolves as pregnancy ends. However, it is a good idea to discuss every new symptom with your doctor, who can rule out serious conditions linked with edema, such as very high blood pressure or preeclampsia. So what causes swelling in pregnancy? Your body is hard at working more blood and fluid to help support your growing baby, your placenta, and an increased fat store. This extra fluid can make you look and feel fairly swollen. Your growing baby and uterus put a lot of pressure on your circulatory and lymphatic system, which can contribute to swelling as well. Some women start to notice the swelling early on, but it usually develops during the second and third trimester. Although we often have little control over the swelling, some things that can increase swelling during pregnancy include when you stand for a long time, prolonged activity, hot weather, eating a lot of sodium or salt, low levels of potassium, and high levels of caffeine. So when is swelling a concern during pregnancy? First one is preeclampsia or high blood pressure. Until fairly recently, swelling was one of the symptoms used to diagnose preeclampsia or high blood pressure, a condition of high blood pressure during pregnancy. It is no longer part of the diagnostic criteria, yet many women with elevated blood pressure do have swelling. Second, blood clot. Deep vein thrombosis are blood clots that can form in veins. The risk of a DVT increases a bit during pregnancy because your body is producing more of the component of blood responsible for clotting. Other symptoms of a blood clot include pain, hardness, and redness. You might also notice one leg is more swollen than the other. The most common site of a blood clot is your lower legs, though they can occur in other places. If you suspect you might have one, seek medical treatment right away. Skin infection is also a cause of swelling. If you develop a skin infection called cellulitis, you may also have swelling. You might have a fever, pain, and blister as well. Again, this would be a reason to get medical attention right away. So when should you see a doctor for swelling in pregnancy? If you experience any of these symptoms, get in touch with your care provider as soon as possible. Pain, redness, hardness, plus swelling in an area of your body. One leg that is more swollen than the other, swelling in your face or hands, headache, lightheadedness, belly pain, difficulty breathing, and fever. Let's go now to the hematologic changes in pregnancy. The major pregnancy-related hemodynamic changes include increased cardiac output, expanded blood volume, and reduced blood pressure. These changes contribute to optimal development and growth of the fetus and help protect the mother from the risks of delivery, such as hemorrhage. When you're pregnant, you may develop anemia. When you have anemia, your blood doesn't have enough healthy red blood cells to carry oxygen to your tissues and your baby. During pregnancy, your body produces more blood to support the growth of your baby. If you're not getting enough iron or certain other nutrients, your body might not be able to produce the amount of red blood cells it needs to make this additional blood. It's normal to have mild anemia when you're pregnant, but you may have more severe anemia from low iron or vitamin levels or from other reasons. Anemia can leave you feeling weak and tired. If it is severe but goes untreated, it can increase your risk of serious complications like preterm delivery. If you are anemic during your pregnancy, you may need to start taking an iron supplement or folic acid supplement in addition to your prenatal vitamins. Your doctor may also suggest that you add more foods that is rich in iron and folic acid to your diet. So let's go now to the changes that happen in your gastrointestinal tract. As pregnancy progresses, the stomach and intestines are displaced by the enlarging uterus. As the result of the positional changes in these organs, the physical findings in certain diseases are altered. Gastric emptying time may be prolonged. Pyrosis, or what we call heartburn, or hyperacidity is common during pregnancy, and this is most likely caused by the reflux or backflow of acidic secretions from the stomach into the lower esophagus. Constipation is another gastrointestinal symptom that is commonly encountered during pregnancy. It is associated with the narrowing of the colon as it gets pushed by the growing uterus found adjacent, leading to mechanical blockade. Reduced motility in the entire GI system as well as increased absorption of water during pregnancy are thought to be contributing factors. Although hemorrhoids can appear at any time, most moms-to-be get them in the third trimester, starting around 28 weeks. Increased blood flow to the pelvic area, as well as pressure from the enlarging uterus and growing baby, can cause the veins that run through the anus to swell. Next, let's discuss what's the changes that happen in your genitourinary system. Your bladder rests under the uterus. As your growing baby expands, the bladder gets compressed or flattened, making less space for urine. This extra pressure can make you feel urge to urinate more than normal. Because you're pregnant, your growing uterus presses on your bladder. That makes it hard for you to let out all the urine in your bladder. Why are urinary tract infections more common during pregnancy? Hormones are one reason. In pregnancy, they cause changes in the urinary tract, and that makes women more likely to get infections. Changes in hormones can lead to vesicoureteral reflux, a condition in which your pee, or your urine, flows back up from your bladder to your kidneys. This can cause UTIs. When you're pregnant, your pee has more sugar, more protein, and more hormones in it. These changes also put you at higher risk for a urinary tract infection. Because you're pregnant, as I've said, your growing uterus presses on your bladder. That makes it hard for you to let out all the urine in your bladder. Leftover urine can be a source of infection. Respiratory changes during pregnancy. During pregnancy, healthy women experience some increased shortness of breath and increased fatigue. Does the respiratory system change during pregnancy? Yes, many changes occur in the respiratory system during pregnancy. Hormones and physical changes due to the growing uterus can affect the upper and lower respiratory tracts. Some of the common changes that happen during pregnancy in the respiratory system include the following: stuffy or runny nose and nosebleeds. The chest becomes barrel-shaped or increases in size from front to back. Upper movement of the diaphragm. The diaphragm is a large, flat muscle used for respiration just below the lungs. Increased in the amount of air breathed in and breathed out. reduced lung capacity, increased oxygen use. Because of these changes, many women feel short of breath or have some difficulty breathing as the pregnancy progresses. When lung diseases develop or there is a pre-existing condition such as asthma, the lungs may have difficulty compensating. So there it goes. I have shared with you the changes that happen to your body during pregnancy or what to expect when you're expecting. Thank you.